The first phase is called phase one. Phase one is when you have a drug and you're trying to determine if it's safe. So a phase one study typically takes a low dose of the drug, gives it to patients, sees how they do, and then takes another group of patients, give them the next higher dose of drug, and keeps escalating the drug dose until they get to the point where it's not really well tolerated. So this is the first step in really any drug's pathway, is just figuring out, is it safe for patients and what dose is safe and what dose is less safe. Phase two is when you get that information about safety, and now you're trying to look in a larger group of patients to see if there's any reason to believe that it might be effective. So you take a larger group of patients. Let's say a phase one study has 15 or 20, a phase two study might have 50 or 100, and you say, okay, I now know what the safe dosing is for this. What happens if I give it to 100 patients? Do most of them do better than average? Do some of them do well? What am I seeing? And the purpose of that phase two is to help you make a decision about a phase three. And a phase three is when you randomize. A randomization means that you have a group of patients that get the drug and a group of patients that get a placebo or a standard of care as a comparison. And when a patient enters the study, they get randomly assigned to one group or the other. And so the purpose of a phase three study is to prove without really any doubt that there is a clinical benefit. For example, does the group that got the experimental drug live longer than the group that got standard of care or placebo? So phase three studies can be anywhere from 300 patients to 600 patients, and they're much larger sort of undertakings. Now, there are some additional phases that are more newly developed. One of them is called phase zero. Phase zero is when you say, okay, I want to understand whether this drug is having a biological effect in the tumor. So with brain tumors, a lot of times drugs don't get into the brain, and we never really find that out until later. So with the phase zero study, you give the patient one or two doses of the drug before surgery. And then after you go to surgery and that tissue is removed in the operation, you test the tissue to see if the drug got there and to see if it hit its target, if it's a targeted therapy, for example. Phase zero studies can happen at any point in the spectrum. Sometimes you combine it with a phase one, and that's called a phase 0/1.